My name is Meslin, a mother from Zimbabwe, a mother to this 2-year-old Alma. I started noticing some changes on my baby when she was 2 years, 10 months. But before that, there was a delay in her milestones, as well as some weight loss, difficulties to gain weight when she was around 1 year. That got better after 1 year, but at around 2 years, 10 months, that's when I started noticing some changes, and that included changes in fingertips. They turned grayish, and even the toes and the mouth. And so, being a mother and a nurse, it was me fighting against myself. The mother in me could not accept, and the nurse in me was very positive. There was a cardiac problem with my baby. So at the end, the mother in me won. I decided to ignore the symptoms. Up until the 10th of July, it was around 8 p.m. Alma managed to eat, but she went to bed early. And I had my questions because she doesn't go to bed early. So I just thought maybe that day she was tired. She went to bed early at around 8 p.m. And then at 9 p.m. she woke up and started crying a lot. After that, she collapsed and she was unresponsive. I even checked her pupils. They were not responsive. She collapsed and she was unconscious. I looked for help from the neighbors, and then they managed to take us to the closest clinic. We were staying in South Africa then. At the clinic, they managed to put her on oxygen, but immediately referred her to the closest hospital that had cardiologists. When we got there, she was admitted and was seen by doctors who even queried a cardiac problem. They did an X-ray and an echocardiogram. The echocardiogram confirmed she had tetralogy of Fallot. She was admitted for 5 days and we were discharged after that. I later decided to look for other people who had children with the same condition. I got a response from Health for Children Foundation after 5 days, and that was the best day of my life because I knew help was going to come. I then decided to leave South Africa and go back to Zimbabwe so that I could do the process of the documents required for the visa. We applied for the visa on the 17th of September and we got the visas on the 20th. And after that, we had to wait for 4 months before coming here. The waiting was, it was difficult, but I had to be patient because that was the only option I had. Because before we even tried to seek donations for her through a GoFund, but we didn't get any help. So the Health for Children Foundation was my only hope. We got a response on the 17th of January to buy our ticket, and that was the second best day of my life. Then we proceeded and we traveled to Turkey. We met a driver from the hospital at the airport who then took us to the hospital. The reception was excellent. And then the nurses, everyone, the doctors, everyone welcomed us with open hands. And all the blood tests were done, the x-rays, the echo, and then they confirmed the same diagnosis. Though there were some challenges with Alma's blood, but they didn't give up because they were not able to get results from her blood, but they didn't give up. They did their best so that at the end they could help her and come up with the correct results. That was done, and she was successfully operated on the 27th of January. And after that, she was in ICU for a week. All the same, all the staff, the nurses, the doctors, and everyone else, they have been very good. They've been more than good to us and to Alma. She was then discharged from the ICU to the ward after 7 days, where she was nursed post-operative. And now seeing her, I really appreciate, and there are no words that can explain how grateful I am. My family and I are so grateful, because even from the first day she was out of theater, I noticed some changes. There was no cyanosis anymore. The mucous membranes were pink, the toes, the hands, they were pink. So we really appreciate the Health for Children Foundation for a job well done in saving my child. I think by now I could have lost her if it was not because of them. We are thankful, and we just hope you keep on helping less privileged people like me and my daughter. Thank you.